This is a quick update video for patients and physicians about people who are on GLP-1 drugs for diabetes or weight loss. So the American Society of Anesthesia just came out with some consensus-based guidance on preoperative management of these patients. So as we know, patients are on these drugs for weight loss or diabetes. One of the big side effects is GI, so nausea, vomiting, delayed gastric emptying, and this group looked at the evidence and they acknowledged that it was very scant. There are a few case studies, but because there is a higher risk of regurgitation and pulmonary aspiration, meaning that stomach contents can come up and be regurgitated by the patient while they're under anesthesia, and that can go in your lungs, causing a bad type of pneumonia called aspiration pneumonia. They came out with recommendations, and I'll add the actual recommendations to this video, but they came out saying that patients should consider holding those agonists the day of surgery if they're taking them daily, and then hold them the week before if they're taking them weekly. So this doesn't matter, it doesn't matter why the patient's on these drugs, whether it's for diabetes or weight loss. And they also recommended that if the patient did hold the drug for longer than that dosing schedule, daily or weekly, that they consider consulting endocrinology for follow-up so that the patient doesn't become hyperglycemic or have a very high blood sugar. So the day of the procedure, if they're taking them daily, or weekly if the patient is on these drugs weekly. They also said that they have no evidence to suggest the optimal duration of fasting, but that people should follow these guidance examples until there is adequate evidence. They may adjust it in the future. So that's the up-to-date information about GLP-1s and surgery, and I'll attach that article below.